Hello, my name's Chris and I'm one of the cancer support workers at Yeovil Hospital. And I'm here today to talk about the hidden costs of cancer and ways that we might be able to help this. So finances can be difficult to talk about. However, it's one of the main concerns people do have when we speak to them. 4 in 5 households are financially affected following a cancer diagnosis, and this can incur an extra monthly cost of £570, and this is due to the reasons which will be listed on screen. These reasons are just some of the more common concerns we hear from people. You may have other financial concerns. Your income may have gone down. You may have had to stop working. This could be alongside extra costs such as travel, food, possibly extra heating in your home, and you may be borrowing more or falling behind on your mortgage payments. Understandably, this will create a lot of stress. However, help is available from a lot of small different ways. For example, following a cancer diagnosis, you should be able to get free prescriptions, and this can be completed by filling out a simple form that you can either get from your clinical team or your GP. Macmillan grants may be available for you and can also help for a multitude of reasons. Some people I speak to have had a grant for things such as aids around the home. It might be for beds or chairs just for comfort if they're struggling to sleep. And it can also be to help cover the rise in food and travel costs. You may also be eligible for winter fuel allowance. Hospitals also now have free parking for cancer treatments, and there can also be people who can help walk your dog if you are going for treatment and you're not too sure who will be able to help. A concern for many people, understandably, is how their cancer will affect their work life. Cancer diagnosis can affect work either in the short term and longer in the future, and this is a very real concern for a lot of people. It is a good idea to contact your manager or your human resources department early on and keep them in the loop of what is happening with you in terms of treatment. If your work has an occupational work or health advisor, they can support you with work decisions and liaising with your employer in a confidential way. Macmillan, a very good informative work information pack, which has information of your rights as an employee, as well as information that you can give to your employer and your boss, and just has some helpful tips that shows how they can best support you. You might want to work differently. This can include reducing the hours you're working, a slight change in job role to something that isn't so manual, or even working from home. And carry on working. Some people do stop after they receive their diagnosis, as it is a lot to take in. And some people aren't ready to face work yet, and it's not a shame at all. However, for some people, they find work gives them a sense of normality and a bit of a routine. But likewise, it may be too much to handle on top of everything else you're managing. And for those who are self-employed, financial support can also be available. One concern for a lot of people is travel insurance. It is assumed that getting insurance to cover your travel or your trip can be more difficult when you receive a cancer diagnosis. As a cancer diagnosis is like any other medical condition, and it is used as a risk factor for making claims on things such as medical expenses. However, fortunately, this outlook is slowly changing. Many companies will look at your individual case now, and a certificate from your doctor or your consultant saying you are fit to travel is sometimes helpful, and you can receive this from your clinical team. I really suggest looking on the online Macmillan forums or the cancer research website, as they have a lot of good information about cancer-specific travel insurances and people's experiences of who they've recently used for travel. The Citizens Advice can also help for grants for local holidays in your area. And the Citizens Advice, if you have not already been in contact with them, are a fantastic support for people around. If you have had your working hours reduced, or maybe you have to stop working and your income is affected, you might be encountering the welfare system for the first time. And this is something I've come across a few times, and it is quite daunting and very confusing. We suggest you get advice from your local Macmillan Citizens Advice, and they can help apply for certain financial benefits. This might be for the attendance allowance or the personal independent payment. They can also help with non-financial support, such as getting a blue badge, if it just helps increase your independence and your mobility to get out and about. The Citizens Advice can see you either in the hospitals, in GP surgeries, as well as the schools, and they do a lot of work over the phone. It is a confidential and free service, and if you'd like to know further, then please speak to your clinical team or Google the Macmillan Citizens Advice Somerset. If you do have any further questions or concerns, there's a lot of fantastic information available on the Macmillan Cancer Support website, as well as the Citizens Advice website. And you can speak to your local team or your clinical team about being referred to your local team. Thank you very much.